Well, back pain in general is common in the population, and in athletes we even see it much more common. In particular, from our first studies with the F-MARC, we have seen that the youth, due to the core muscle deficiency, they had more back pain than general population. So it's something which has to be taken seriously and already at the early age to account for the deficiencies. When you take the career of a footballer from youth, and usually they start with under 10, under 11, and then they go through, we have two different groups. Those who are developing to professional football players and those who stay lifelong as a recreational. And we encourage to play football through the lifespan. Don't stop after the active career. So in the youth, there is more back pain than there is in the third decade. We are confronted with acute disc problems like disc prolapse, disc protrusion, which can cause radicular nerve root compression with pain in the legs. And the older you get, the more degenerative changes are occurring within the spine, the cervical and lumbar spine. And then it's more predominantly the low back pain. And at the 6th, 7th decade, and we have football players in this where they are playing recreational, then we are confronted with narrowing of the spinal canal, the so-called spinal stenosis. Each of those entities have to be approached differently. Surgical treatment has to be very carefully evaluated, exploit all possibilities of conservative treatment, but there are some situations when there is an absolute indication for surgical procedure in the adolescents and particularly the professionals if they have a deficiency of the muscle force of the leg, which would indicate a compression of the nerve root, motor palsy, and it's progredient, then you have to act fast. Of course, you exploit all the MRI and images, and if there is a clear finding corresponding to the neurological deficiency, then there is an absolute indication for surgery. Well, the injections, the infiltrations, it's part of the conservative treatment. And I always exploit that first with physiotherapy, rehabilitation, muscle rehabilitation, but in acute, for example, cervicoradicular symptoms, where we have also finding on the MRI, then I apply nerve root injections. It's a demanding technique, but very successful. And also in the lumbar spine, when there is a disc protrusion without neurological symptoms and without neurological findings, then definitely the injections either of the joints, intervertebral joints, nerve root, or even a sacral block is indicated. So it's a useful technique, but has to be done under fluoroscopy or ultrasound guided, and it has to be done by somebody who has the experience to avoid any complication, particularly in the cervical spine. Rehabilitation is for me more a part of prevention. And the earlier we start, the better. When we designed the 11 plus, then it was designed for the recreational, for children and adults, men and women. And the core of the 11 plus was actually strengthening of the muscles of the anterior spine muscles and the posterior, the core muscles. And that has to be done through the lifespan. It's actually good for everybody. It should be like brushing your teeth, do some of the exercises every day. And we have examples, top football players, like one of my favorite, Pavel Nedved. When we saw the 11 plus, he said, this is what I do since my childhood. And he never get injured, and he never had back pain. So this is something we have to account. So the muscle rehabilitation, best if you can do it alone at home or before the training, this is the best prevention of getting low back pain.